So in my 24 years of practice, I would say we've had more fibromyalgia patients than any other condition. I think there's a lot of reasons. I think the biggest is even medicine has a hard time just treating the symptoms of fibromyalgia. And then it also seems that one fibromyalgia patient comes in and they know 10 others. And so the next thing you know, we get a bunch of them all coming at the same time. Well, I want to take a couple minutes just to explain to you a little bit about how upper cervical chiropractic has had such good results and why it can affect fibromyalgia. So what happens is most of the time with fibromyalgia, people have a lot of musculoskeletal pain and discomfort, right? Neck pain, oftentimes headaches, upper back. Sometimes it goes down the arms, sometimes down the legs, sometimes in the back, lower back. I don't know that any two fibromyalgia patients have the exact same symptoms, but most of the time, or almost always, they have a hard time sleeping. They have chronic fatigue, often goes along with that, since you're not getting good deep sleep. And then, of course, all the body aches. A lot of times they'll have digestive problems, maybe reflux, maybe irritable bowel. And then sometimes even if you've had it long enough, oftentimes they have depression. So what we have found is all of our fibromyalgia patients have one thing in common, and what that is a misalignment at the very top of the neck. Now, how could a misalignment, how could a bone at the top of the neck affect the entire body? Well, a lot of different ways, 2 ways to be specific though. Let's talk about the communication, the brain to the body communication, okay? It all happens from the brain. It goes through the brain stem at the very top of the neck, and then it sends messages down to the arms, the legs, the back, the hips, the knees. So if the communication is interfered with, then those parts of the body don't get the full message like they should, so they don't work the way they should. And so muscles become tight. The body compensates and kind of contorts itself. A lot of times you'll see fibromyalgia patients that have a little bit of a head tilt or maybe a low shoulder because their body's kind of contorted, and so their muscles are getting weak and fatigued and tired. Another very big part of this is the brainstem, because the brainstem comes out through the top 2 bones. And the brainstem sends all the messages. Maybe it can affect your digestive system, okay? Maybe it can affect your sleep. The sleep center resides in the heart of the brainstem. So if a bone gets out of line at the top of the neck, it can actually prevent the body from shutting itself down and getting through all 4 stages into deep sleep. So you never fully recover. A good example of this would be, say you went to the gym every day and did just biceps. Every day you went in and lifted biceps, okay? So you're constantly wearing down those biceps, but if you never give the biceps enough time to heal those muscles before you go work them again, then they always stay sore and painful. Well, think about it this way. You're constantly fighting against gravity. You have postural muscles. You're moving, turning, bending. Well, you need to get into deep sleep so those muscles can regenerate and heal before you go and start using them again. Well, if your body's never getting into stage 4 deep sleep and fully healing from the previous day, then you're constantly just wearing down the same muscles and wearing them down and wearing them down and wearing them down. So they hurt. You have neck pain and back pain and hip pain and arm pain, leg pain. Then you go to your medical doctor, and what do? Typically, they're going to give you a prescription, right? A medication. What's that going to do? Is it going to fix the fibromyalgia? Yeah, I don't think you have a drug deficiency, so taking medications isn't going to fix it. It might mask the symptoms temporarily, but they're still there. You just don't sense it in your brain, right? So the traditional medical route hasn't been very successful. Most of you know that if you have fibromyalgia. So what we have to do is figure out there's something going on within you. And if we can find that and we can correct it, then the body can actually function as it's supposed to and can actually heal itself. So what we do at Upper Cervical Spine Center is we do a thorough evaluation of what's going on at the top of the neck and determine if you have a problem we think we can help you with. Now, we never charge for a consultation. The consultation is always free to come in and sit down with one of our doctors to see if you might be a candidate, if you might have an upper cervical problem we think could be creating your fibromyalgia. If so, we'll explain to you what we need to do to go further and find out exactly what's going on. We take a series of x-rays, etc. If not, then if we don't feel that you have an upper cervical problem creating your symptoms, then we'll be happy to find somebody else that we will refer you to. Okay? So call the number on the screen. If you're in the Charlotte area, give us a call. If you're not, then find the closest upper cervical doctor to you. But if you're locally, call the number below. We'll be happy to set up your free consultation to talk to one of our doctors to see if we can help you with your fibromyalgia. If you have any questions, give our office a call. We'll be happy to answer any questions we can. Thank you for tuning in. We look forward to meeting you.